Imagine yourself in this situation. You're told by doctors it was very likely that your young daughter had a large cancerous brain tumor.
Yeah, that's what one Naples family was dealing with. Fortunately, though, they didn't have to worry long. With a pediatric neurosurgery program right down the street, they got a better look at the problem and treated it within days. My News health and medical reporter Amy Osher has the details.
This may be the first time a one-handed cartwheel's been executed in Golisano Children's Hospital. Appropriate because not long ago, 7-year-old Lila Foss's world was turned upside down.
She got really sick one night, so we went to the ER.
For a month, Lila had persistent fever and headaches. Doctors prescribed antibiotics, but nothing helped.
We ended up back at the ER again saying, hey, she's not well and it got worse. Something is different.
When doctors did a CT scan of her brain, they saw a large mass. They told Lila's family it looked like a golf ball-sized tumor and was likely cancer.
The first thing was denial. That can't be happening.
Their first thought was to leave Southwest Florida to get a diagnosis and treatment.
And the attending physician came back in and he said, if you want to go there, I'll send you there. But before you do, I think you should know, Golisano Children's Hospital is in Fort Myers. It's a whole lot closer, and they're building a great team there.
That decision made a world of difference. Pediatric neurosurgeon Theodore Spinks didn't see a tumor, didn't think it was cancer.
And the MRI kind of confirmed that it was an abscess, an infection in her brain, which is not a good thing, but better than their original diagnosis.
A brain abscess is an infection that generally starts somewhere else and then travels to the brain. With no blood supply in the mass, oral antibiotics can't get in. So the ball of infection grows bigger and bigger.
If it ruptures out to be around the brain, then it becomes potentially disastrous.
Facing life-changing disability, Lila's outcome was in Dr. Spinks' hands.
It's a surgical disease in that I have to drain the abscess, but it's not a surgical disease in that really the treatment is the antibiotics. So my job is to just make sure that the antibiotics can get in and kill the bacteria.
After only 7 days, Lila left the hospital. With Golisano close to home, she's a frequent visitor.
He's Dr. Spinks. He's one of my favorite doctors.
Bouncing back like a kid, Lila's ordeal is now just a memory. Amy Osher, Wink News.
Well, doctors aren't sure what caused that brain abscess, but it only took a cycle of IV drugs that delivered at home to completely rid her of that infection.